everyone, my name's Dr. Steve Simpson and I'm talking to you today from Portugal. The subject of this week's blog is more about spontaneous remissions because I had a lot of interest and comments following my last blog. In summary, a spontaneous remission is an inexplicable recovery from serious illness, very often cancer. We don't know how often this happens, but it's likely to be very rare. Now, I've been digging around in the research and I'm just as confused as before, but hopefully at a deeper level of confusion. I think some Roman generals said that. Before I start, I'd better give a health and safety warning. Nothing that I say should be seen as medical advice. They're very much my own preliminary findings on fairly superficial examination. Those of you who are interested, I think at least I will point you in the direction of where you can do deeper research. So one interesting thing that did surface is a theory that's been around for about 200 years at least, and that is that in some way fever can cause remission of cancer. Another theory to explain it is that perhaps when the body is confronted by infection, which would cause a fever, this stimulates or boosts the immune system, which also is able to deal more effectively with the cancer cells. Now, nobody has really taken this research very much further, as far as I know, but I've spent most of my life working in Africa, and of course there are huge differences between the incidences of cancer in Africa and in the Western world. And it just might be, one possible explanation just might be that in Africa, sadly, fever is very common. Infectious diseases are common, and then you have things like malaria and dengue fever. I've had both of them, by the way, and they're not at all pleasant. So perhaps there's some protective effect there. Who knows? Further into the research, I've read a book and read some papers by a doctor who works at the University of Maryland called Lydia Temoshok. The book that I read that she wrote is called The Type C Connection, The Behavioral Links to Cancer and Your Health. And in this book, she identifies some key characteristics of the survivors of cancer. And I'll read them to you. Well, the first thing is her overall assumption that the cancer patients in her study were extremely nice people. And in fact, it could be that perhaps they were too nice, because if you're going to come to terms with cancer or control it or even hopefully even defeat it, then you have to have a bit of attitude. Anyway, back to these 8 secrets. Number 1, or not secrets, but common characteristics. They are realistic and accept their diagnosis and do not take it as a death sentence. Number 2, they have a fighting spirit and refuse to be helpless or hopeless. Characteristic number 3, they have changed their lifestyles. They are assertive and able to get out of stressful and unproductive situations. 5, they are tuned into their own psychological and physical needs, and they take care of them. Characteristic number 6, they are able to talk openly about their illness. 7, they have a sense of personal responsibility for their health and look at the treating healthcare provider as a collaborator. Number 8, they are altruistically involved with other persons. Now, this was HIV in this particular case, but it could be any other kind of cancer. So those are things that are well worth considering. And now, what would I do if I was faced with cancer? I don't know, and I hope I never have to find out. But I would probably carry on doing pretty much what I'm doing at the moment, although more of it. I think diet is likely to be very important, and there's all kinds of studies going on about diet. For the record, I've been a vegetarian for 30 years, and I feel pretty fit and healthy on it. And for the last 1 year, for no particular good reason, I have been on a gluten-free diet, and I definitely do feel better for that. I've lost weight. I'm pretty much at my ideal body weight right now. And I had a very serious pine allergy pine pollen allergy, which has disappeared and hopefully will never come back. And I also feel that the minor arthritis I had from time to time is better. So that's well worth thinking about. I would avoid things in my diet, I think, like artificial sweeteners. Again, the research here is highly contradictory, but I don't really need them, so why would I take them anyway? I would carry on taking exercise every day. I've been meditating since the age of 21, and so I would carry on doing that every day. I mean, it's the first thing I do in the morning and have done for many, many years, and I'll definitely continue that. And I would avoid pollution as far as is possible. And we're surrounded by pollution. Fortunately, where I am at the moment in Portugal, it's about as healthy as you can be. But I spend a lot of my life in London as well, which, like most cities, is quite highly polluted. So hopefully those two things will balance themselves out. And a final word of warning for those of you who do research this subject at a deeper level. Even the experts can't agree on so many things. And recently, the editor of The Lancet, which is a prestigious British medical publication, and the editor of the New England Journal of Medicine, which again is a prestigious US publication, both of them have expressed misgivings about the quality of current medical research and some of the conclusions that are drawn from it. Again, there's lots on the internet about that. Some of it you have to take with a pinch of salt. But it is just a word of caution that this is a rather complex field. So at the end of the day, you're probably going to have to make up your own mind and make sure you don't do anything that's going to damage your health. But even if it makes you feel that you're in charge and feel that you're doing positive things, that I would imagine has to be better than nothing. So there we are. I'm going to continue to keep monitoring this situation, and if I find anything more, you will be certain it'll be included in a future blog. So that's it for this week. So have a fantastic week, whatever you're going to do, and we'll meet again soon. Thank you very much for supporting this channel.